And then checking for red flags. Yes, every patient's coming into my clinic, I always think about any red flags. And these are my red flags. Unstable vital signs. They're coming in for severe symptoms, any constitutional symptoms, any severe neurological, cardiac, and respiratory symptoms. So you have to really look at your patients. Look at the whole picture. Keep an eye out for red flags and learn about the specific warning signs for different disease processes. And I know you learn about this in school, so I just want you to make sure you got this, okay? Because these red flags signal serious conditions, right? And this help you decide whether or if immediate emergency care is needed, or if you can just closely monitor your patient, like maybe just have the patient come back in the next day or two so you can make sure that nothing else is going on, right? Because our priority is our patient's safety. Okay? For example, if a patient has symptoms of acid reflux or GERD symptoms, but also mentions weight loss and hoarseness, this is a different situation than just GERD alone, right? Because in the first case, we should consider about cancer as a possibility because of the weight loss and hoarseness. But in the second case, we could just suggest dietary changes and medications like PPI. Does that make sense? Okay. So moving on, special patient populations. And these are, this population listed here: children, elderly, immunocompromised patients, pregnant patients, and patients with multiple comorbidities. So special patient population require careful consideration, right? And we really need to be careful with our management. For example, for an elderly patient, they're at a higher risk of taking multiple medications. This is what we call polypharmacy, and which can lead to complications. So it's very important to check for any potential drug interactions when prescribing medications to them. I also want you to take into account the Beers list to make sure that you're not prescribing medication to this population that can cause complications, right? Okay, so similarly, patients with multiple comorbid conditions also need extra attention. Each condition may interact with others, right? Affecting our treatment choices. And we have to take into account that they would have better outcomes. So it's important to assess the overall health picture of our patient and customize our management plans accordingly to ensure that our patient get the best possible care. All right. So by addressing their specific needs, we can help improve their health outcomes and quality of life. Does that make sense? All right. So lastly, I want to share to you this. This is a case study. So this patient is a 37-year-old male with type 2 diabetes and hypertension. Chief complaint, FMLA extension, and podiatry referral. So his vital signs were significant for elevated blood pressure. So this is pretty high. but physical examinations unremarkable, and initially he denied any symptoms. He said he was fine. And so I want to share this story to you because I want you to learn from this experience. So this patient came in feeling fine. And so, like I said, he's only wanting FMLA extension and podiatry referral. So he, in the beginning, he said, "Oh, I feel fine. I don't have any other concerns." So I took it at face value, assuming no symptoms were bothering, the patient. And so once I finished sorting out his FMLA paperwork and I discussed his nail issue, so I used my old card to gather more information about his nail issue. And then after that, I wanted to address his blood pressure. So I made some adjustment to his blood pressure medication. His physical exam was normal. Heart rate was normal. Rhythm sounded fine. I didn't even hear any murmur. So let me ask you a question. What else are you considering about this patient based on his presentation? Are you concerned about an ACS, acute coronary syndrome? Yeah? Great. Well, let's find out. So, after I adjusted his medications, I gave him precautions like I always do. So I would say, so if you develop chest pain, shortness of breath, dizziness, please proceed to ED or urgent care and come back again in 1 week to recheck your blood pressure. Well, guess what he told me after? "Oh yeah, I am having chest pain right now, but I always have chest pain when I have allergies too." Oh, sigh. So I gathered more information about his chest pain and he revealed it felt like a pressure on and off throughout the day, lasting few minutes, and has been ongoing for the last 3 days, and it's not provoked. It just happens randomly. And so he denied any other symptoms. I was asked shortness of breath, feeling nauseous. Are you feeling fatigue? Are you feeling like your heartbeat is irregular? No, nothing. And then he then told me he just wanted his FMLA referral today. I was initially thrown off though by his explanation that his chest pain was just a symptom of his allergies. However, given the potential seriousness of chest pain, I didn't want to take any chances, so I instructed my medical assistant to send him to urgent care to ensure he received proper evaluation. Right? We don't do chest pain in our clinic, especially if it's a true ACS. As part of the urgent care protocol, my MA asked for an order for EKG, which is typically recommended in such cases to rule out any cardiac issues. And so we did that. What do you think his EKG looked like? Any guesses on the EKG results? If you guessed abnormal, you're heading in the right direction. Well, this patient had ST elevation on multiple leads, so we called EMT right away and sent him to ED. Okay, and he actually had multiple vessel disease. So this experience underscored the importance of conducting a thorough review of systems and prioritizing more concerning symptoms or finding, like in this case, he had elevated blood pressure before spending too much time on less critical concerns, like I did, right? This ensures that potentially serious conditions are not overlooked or delayed. in receiving attention. So I should have addressed his blood pressure in the very beginning instead. And this was a real eye opener for me. Considering his type 2 diabetes and high blood pressure, ACS or acute coronary syndrome should have been a top concern. Don't you think? All right. So I hope you enjoyed this video and found it inspiring as well as informational. I know you've learned this from school and you're doing this. I just want to reinforce it that it's not that hard if you just keep doing it over and over again. And remember, I'm here for you as your mentor and as a friend. And bye for now.